Run.
That's right, folks. Run. We're back here with another installment of the problem with that. And today's problem with that, I'm just going to title the COVID-19 pandemic. It's going to be more talking about the younger generation in the pandemic, but for the most part, this fits for everybody. By now, we've gotten the message. You're selfish if you'd like to do the kind of things that once gave your life meaning. For these people, life is about nothing but the avoidance of death. Virtually everything you've looked forward to has been canceled, and nobody will tell you when you can have those things back. When we have a vaccine, comes the raving lunatic's answers. Nobody was giving you that answer when they were pushing 15 days to flatten the curve. They didn't care. Instead, they kept us in our homes for those 15 days, and then 15 days after that, and then 15 days after that. Each time they pushed the date back, we grew more demoralized, more resigned to a barren life without large gatherings, i.e., everything that makes life fun, and virtual events over Zoom. Oh, and no hugs, no weddings, 10 people at your father's funeral, and a long list of other grotesque demands. What metrics were they using to decide when we'd be allowed to be back out again? When our businesses could open, and when they could operate at a level that made profit even a remote possibility? And when those life-giving pleasures that bring us meaning and fulfillment could be resumed? Who knows? All we heard was, everything is canceled. Maybe you can have it in 2021. Maybe you can have it when there's a vaccine, as if there's a guarantee to that. Well, a terrifying statistic came out last week showing the grim, if entirely predictable, effects of all this inhumane regime that has been having on the young, particularly those between 18 and 24. The federal government Substance Abuse and Mental Health Service Administration has compiled percentages of people who have considered suicide within the previous 12 months, organized by age. The 18 to 25 group fluctuates between 6.8% and 11% over the past several years. Now, from the Center of Disease Control, we find that the percentage for the 18 to 24 group has leaped to 25.5%. And this survey asked not about the previous 12 months, but whether they considered suicide in just the past 30 days. There's also a huge jump in the number of people in their mid-20s through their 40s. We've taken away everything they love, deprived them of the opportunity to socialize and experience their irreplaceable moments of youth, and demand they accept this dystopia as the new normal. Now that's selfishness, people. Part of the natural order is that parents make sacrifices for their children, not the other way around. If vulnerable people wish to isolate themselves, which is a perfectly sensible cause of action for some individuals, then they should isolate themselves, not demand that young people sacrifice everything dear to them and live atomized existence for a period of time that our overlords refuse to specify. As I pass through middle age, the thought would never occur to me to make these demands of younger people. Am I prepared to tell them that while I enjoyed these pleasures when I was younger, for the sake of my comfort, they cannot have them? Who thinks like that? Some of us, yes, even many of us in middle age and beyond, are prepared to say this is no way for anyone, young or old, to live. We want a life that includes weddings, family celebrations, hugs, live concerts, drinks with friends, thriving businesses, the arts, school dances, theater, and friendship from less than 6 feet away. And we're willing to accept whatever risks accompanies these things. Because no other kind of life is really worth living. And it's not just the deprivation of basic, non-negotiable joys that the lockdown causes. Even the New York Times admitted the lockdown will lead to 1.4 million excess tuberculosis deaths, 500,000 excess HIV deaths, and 385 excess malaria deaths. This on top of the 1.2 million children UNICEF expects to die as a result of the lockdowns. Not to mention how many people have been prevented by deadly regulations driven by irrational fear or by irrational fear itself, drummed into them by a grossly irresponsible news media from receiving major medical care they need. In the UK, they've been predicting more avoidable cancer deaths than COVID deaths because of this problem. Meanwhile, doomers have been peddling a comic book version of this virus. When Wisconsin court said bars could reopen, this was supposed to lead to a massive spike in deaths there. All the social media scolds said so, because social media. No such thing happened. Did this cause them to rethink their comic book approach? You can guess the answer to that. They particularly cheered when spikes hit Arizona, Texas, and Florida, and they blamed those states' reopenings, even though those states had been open for 8 weeks before the spikes occurred. Those spikes are over now, and they were brought down without lockdowns. Yes, some bars were closed, but what really happened is that they simply pretended they were restaurants. South Dakota never closed at all. They had an outbreak of a meatpacking plant, but those are unprecedented, unrepresentative of society at large when it comes to the virus. The state is doing great. Just 17 deaths per 100,000. Oh, they have a low population density, you say. Well, instead, that disaster was bound to strike there. Even mocking the governor, you realize it's an infectious disease. Everybody wants to criticize Sweden for not locking down. And no wonder. If a country can have good results without locking down, it makes the lockdowns look like a crazed sociopaths they are. Oh, Sweden had a high death rate, you say. That's how the doomers report it. Well, around 3/4 of the deaths in Sweden occur in some kind of long-term care facility. And the Swedes admitted to their failure there. But that has nothing to do with the overall soundness of Sweden's approach. Since those facilities are isolated from society, how did society at large do? Extremely well. Number of people under 50 who died out of the country of 10 million? 70. These days, there are barely any deaths in Sweden at all. The virus does what it will do, despite the ad hoc destructionism of our control freaks with their white coats and clipboards. There's a sickness out there, all right, but I'm not talking about COVID-19. I'm talking about their irrational, fact-free response. Demand your life back. Take your life back. That isn't selfish. You have one life. You want to live it. That's normal. What's selfish and abnormal is the presumption that other people are entitled to your life. If they want to live as prisoners in their own homes and experience life over Zoom, by all means be my guest. The rest of us intend to live.
Oh shit! Oh shit!